आपणक स्वास्थ्य आम दायित्व चिकित्सा भित्तिक कार्यक्रम द डॉक्टर्स केवल HM वेब टीवी रे।
नमस्कार द डॉक्टर्स प्रोग्राम को स्वागत करछि मु सरोजनी। आमे वर्तमान एबे अछु हाईटेक मेडिकल कॉलेज एंड हॉस्पिटल रो यूरोलॉजी डिपार्टमेंट रो आम सहित अछंती डॉक्टर परेश चंद्र माझी। तांको सहित आमे विशेष आलोचना करिवो। आज होछि विश्व किडनी दिवस, से विषय रे आमे आलोचना करिवो डॉक्टर को सहित।
बेसिकली द किडनी आर द vital organ of our body which is meant for excretion, acid base balance and fluid and electrolyte balance of the body. So it is the one of the most important organ of our body. So the day is celebrated on the second Thursday of March every year to encourage the people and create the awareness of the kidney disease among the people, because nowadays around 85 million of people are suffering from chronic kidney disease, which is a very large population. If we will know a little bit about the kidney disease, we can encourage the people, and they need the hospitalization and treatment very early so that we can avoid the major consequences. Because the day is initiated by Joint International Society of Nephrology and International Federation of Kidney Foundation. They jointly initiated the day, and from that day it was celebrated as World Kidney Day. So the main aim of this day is to encourage and increase the awareness among the people about the chronic kidney disease. There are so many conditions, so many diseases are there which are affecting the kidney and causing ultimately kidney failure. We will discuss about that. So diabetes, hypertension and glomerulonephritis are the genetic diseases are there, because of which the kidneys are get affected, and ultimately on due course chronic kidney disease, and sometimes they are managed with medication. Ultimately they land in hemodialysis, and finally only one research is available, that is kidney transplantation. So the basic aim of the day to celebrate is to create awareness among the people, to bring the people at early stage, and they should know the symptoms and signs quite early so that they can consult their doctor. We can treat the disease at earlier stage.
यार सब कोन कोन लक्षण सब रही छै?
That is a good question, because all the patients usually they are affected very early, but their symptoms presented later. So they may present with either anorexia, vomiting, bilateral pedal swelling, or ascites, or failure to, they are not able to feel better, and their anemia. So many diseases, so many symptoms usually they present later. This is why we usually suggest the people to come very early, even if they are not taking food properly and feeling anorexic and nausea, vomiting. These are the early symptoms of the chronic kidney disease.
किडनी रोग पई कोन सब रही छी ट्रीटमेंट सब कहिबे से विषय रे?
There are so many diseases affecting kidney, either primarily due to kidney itself or secondary to any medical condition like diabetes, hypertension. So many conditions are there. They are affecting the kidney, ultimately damaging the bilateral kidney. So according to the stage of the disease, most of the patients are usually managed with medication, initial treatment. Then those who are not responding in spite of medical treatment, if the kidney damage progresses further, so we can shift to sometimes hemodialysis. Usually it's the process to excrete the wastage of the blood via any circulation. Another machine is there that is called as hemodialysis, but it is the function of usually kidney, which is usually meant for excretion of the excreta. But when it is get affected and its kidneys, both bilateral kidney is unable to perform his work, then we have to depend on the machine, that is called hemodialysis. The ultimately, when the patient, in spite of repeated dialysis, even kidney damage progresses and patient deteriorates, then we will finally go for renal transplantation. Nowadays, previously live donor transplantation was there. Nowadays, even Odisha, already second cadaveric transplantation has been done. High-tech medical college also donated his, one patient has agreed for that cadaveric transplantation. We did that harvesting of these kidneys in the help of the SC medical college team, and they have transplanted the bilateral kidney in the two patients. So ultimately, we may need kidney transplantation at the last stage, but initially we can manage with medication and sometimes hemodialysis.
सर किडनी ट्रांसप्लांट हो सारा पर रोगी जनक साधारण लोकों परी जीवन यापन करि परिबो ना तार किछि किडनी ऊपर इफेक्ट पकेबो से विषय किछि कहबे?
Good question. Usually following transplantation, every patient is advised medication that is called immune suppressant medicine for lifelong. The patient has to take the medicine for lifelong. So he or she has to continue this medication. With this medication, usually patient's immunity becomes low. So many infection, virus, bacterial infection or fungal infection that can affect the patient. And as well as following transplantation, patient rejection, so many causes are there for rejection of this kidney, because we are donating the kidney from another patient. So this kidney the patient may not receive properly. That is called rejection. It may cause happen with early rejection, delayed rejection. So many rejection processes are there. So we have to lower the immunity of the patient by giving immunosuppressant drug. That drug should be continued for lifelong. So many infection, viruses, bacteria, we have to take care of that. And patient has to take the medicine lifelong. So before transplantation, we usually counsel the patient. This is an alternative method. This is not a pure kidney that you have already, because it's a new kidney we are transplanting. So this is an alternative process, method of hemodialysis is another method, so that you may or may not need further hemodialysis. That will act as your own kidney, and it will excrete whatever work your kidney is doing. It will perform similarly. It will act as your kidney, but it is guarantee it will not act as the same. So many medication we have to continue for lifelong, and so many infection, whatever, we have to be aware of that. And that patient may lead a normal life if the kidney matches very well, and the surgery is usually goes on very nicely. Sometimes patient may or may not be affect any further disease, and some may need any further transplantation or further rejection. So according to that we will manage the patient. So ultimately we have to relook the patient, we have to thorough the patient, monitor the patient. This is not a one-shot procedure, so we have to follow the patient for lifelong. This is the main scenario of the transplantation.
सर साधारण लोकर दुईटा किडनी तो गोटे किडनी जी ट्रांसप्लांट करुच्ची तार किसी प्रोब्लेम पकेबो किडनी ऊपर तार जीवन ऊपर?
I mean, you want to say the donor who is donating a kidney, he or she has only one kidney, and the person who is receiving the kidney, he is also has one kidney, because already two kidney are damaged. So we are lucky enough we have two kidneys. Basically one kidney is sufficient enough for functioning for whatever function it has to do, one kidney can do. So if one kidney acts perfectly, there is no problem. Even after donating one kidney, patient can lead a normal life with one kidney. And the recipient who is receiving also, if that kidney is working perfectly, then well and good, he or she can lead a normal life. No problem. No problem.
सर आम सहित विशेष आलोचना कले आज हूँ वर्ल्ड किडनी डे तो आपको धन्यवाद आम सहित विशेष आलोचना करने।
आपणक स्वास्थ्य आम दायित्व चिकित्सा भित्तिक कार्यक्रम द डॉक्टर्स केवल HM वेब टीवी रे।